I'll tell you the history of this. I think there's nothing more sobering than looking at this and wondering how well do your patients do. And this story begins with a child who was operated on between 1972 and 1974 by Paul Ebert at the University of California, San Francisco, and he did a series of 12 aortic valvotomies in neonates with zero mortality. This particular child that I'm going to show you was the child of one of our pediatric residents. And she actually was doing remarkably well. She was an active horsewoman and was appearing in a jumping show. No physical disabilities whatsoever. Unfortunately, she fell off her horse, and the horse's hoof caught her head. She had a massive cerebral hemorrhage, and she died. And I just want to show you what a ventricle of an absolutely normal child looks like, if I can find it now. Ah, here it is. I'll make it smaller so you can all see it. So here's the ventricle of a well-functioning, successfully treated aortic valvotomy at 12 years of age. And I think you can see on this already the marked endocardial fibroelastosis that is occurring in the left ventricle. What you can't see, and I can tell you because I've held the heart in my hands, is the aortic valve leaflets were thickened and totally immobile. You can see it was a bicuspid aortic valve, so it was both stenotic and insufficient. And if you look at the ventricle over here, there is an area of whiteness related to fibrosis and ischemia. And
it's in the subendocardium.
Exactly. And the aorta itself has got contracule lesions from the jet hitting the wall of the aorta. So, you know, I think that what we have to realize when we deal with aortic valve disease is that it's a lifelong disease, and it's going to require watching, and it's not perfect, and the results of treating it are far from perfect.
Do we know that she didn't fall off the horse because she had a roof or something like that?
Yeah, no, she was active also. She had an accident. To the best of my knowledge, that's the truth, Your Honor, so help me. Okay, lunchtime. We will meet precisely at 2 o'clock, and we will talk about pulmonary valve disease, and we will begin with Dr. Hasbani, who has to leave, and we'll carry on from there.
I'll come join you.